Hello, everyone, and welcome to our member cafe for February. We're so glad that you could join us today. And again, thank you so much for being a part of this Healthy You series that we've got going on. We started in January with our nutrition and health around nutrition and all of the insight around that with Dr. Gray. And this time, we have a special guest. Dr. Johnson is here with us, and Dr. Johnson is a board certified family medicine physician with over 14 years of experience. She's currently serving as the Deputy Chief Director of Physical Health here at Partners. Dr. Johnson also spends the majority of her time in her career, she's spent it in primary care as a doctor taking care of patients from newborn all the way till over 65. She's also very passionate about that whole person care and focuses on the importance of physical, mental, and emotional health. And also, Dr. Johnson is a strong advocate for preventative medicine and is has dictated, I'm sorry, helping individuals and families to live healthier lives and balanced life, right? We're always looking for that life balance that we need. We also have with us Beth Brooks, and she is my supervisor and with member engagement. And Beth is going to help us with the producing part of our time together. She's also going to help us with Q&A. I also have Kimberly Lambert, and she's part of excuse me, our member engagement department as well. She's one of our specialists with member engagement, and she's going to support us with our chats. So we are going to open up our chats to allow you to interact with myself and Dr. Johnson as we talk to you today about our wellness checks or our health checks that we do on a yearly basis. And what we're going to do is we're going to go through all of that information. We're going to hit different age groups and talk about what things to expect and what are some of those different types of testings that doctors do. Why do they do it? Why is it important for us to keep up with our wellness checks, our health checks, our yearly checkups, whatever you want to call them? We definitely want to promote the importance of that preventative care and keeping up with those. A lot of times our lives are super busy and we kind of postpone things, and we want to talk about why it's important to keep up with those. So thank you everyone for being here. Dr. Johnson, thank you so much for joining us today. We have a lot to cover. So
A lot.
I'm going to go ahead and get to it. We do have some housekeeping really quick before we start, and Beth is going to pull that up for us just to give you a little bit of insight with what you're going to deal with. We do have closed caption available today for you, so all you have to do is click on the option in your Zoom for that with the closed caption. You'll see the control feature for it on the bottom of your screen. Unfortunately, we're unable to accommodate AI note takers within Zoom due to cybersecurity reasons. So if we see anybody using those, we're going to have to remove that. And please accept our apologies for any inconveniences that may cause. We're also recording this meeting so that we can share later on in our platform and our website, and also so you can have access to it. So that's also happening. Please do not share your personal information during this session, as we want to make sure that your privacy is protected. So partners, staff, ourselves, we're going to be available for individual issues. So if you want to discuss anything with us outside of this time, please go ahead and pin us directly, but we will share some information towards the end of our time together so that you know how to reach us for any particular needs that you might have. The recording for this session is going to be available at our website, excuse me, partners. It's www.partnersbehavioralhealth.org. You can type Member Cafe in the search bar in the upper right-hand side, and it will take you to our slides and other materials that we have there. Again, we're going to open up chat specifically for engagement purposes. If you do have any questions along the way, feel free to add those to our Q&A. That's going to be open as well. I love reactions, so you can use reactions as we're talking, and anything that bounces out or you relate to, we love to see those reactions. So please feel free to share. Also, towards the end, we're going to share two surveys that we want you to be aware of. They're super quick, and we'll love to hear from you during that time through those surveys. So thank you in advance for and doing that with us. So yeah, I'm gonna go ahead and get us going. Doc, thank you. Sorry about the a little housekeeping there, but we need to make sure we do
Worries.
that, right?
Yeah, no, you gotta take care of the homework for sure.
That's right. That's right. If you don't see Kim and Beth, they're still in the background. They're supporting us. But thank you so much, both of you, for doing that support in the background. So, Doc, as I mentioned before, January, we kicked it off with Dr. Gray, and we were talking about the importance of living healthy lives. And maintaining our health through our eating habits and making sure that we're eating well. And we talked about what health looks like, right? And now we want to talk about, again, these wellness checks. So let's kick it off with talking about staying healthy and the things that we need to do to live that healthy lifestyle. And how does the health checkups or those wellness yearly checkups fit into all of that? Why are they so important?
Well, they're important for a couple of reasons. For me, as a primary care physician, I felt like the physical was like the Super Bowl of your life, right? Each
Okay.
year we get to see you in this one opportunity to, to check on things you've overcome, maybe other doctors you've seen, and just really focus on, your healthcare team really just wants to know what you've been doing. The visits not for that ingrown toenail you've had since you were 17, right? This is really talking about preventative health treatments, maximizing your health, and also in that visit, giving you a bit of comfort and knowing that you're doing everything you can to actively participate in your future health.
Right, right. And you said preventative care, right? So, with that being said, why is it so important for us to really think about that word and what it means as we're thinking about living healthy lives?
Right. So we want to be always proactive, never reactive, or as football Sunday, on the offense and definitely not on the defense, right? We really want to make sure that we are taking the most helpful options that we have, right? Even with the best intentions, a healthy diet, lots of exercise, getting 8 hours of sleep. I don't know who does that. If you do, good for you. But, all those things that
Right,
we tell you as physicians that we want you to be doing, you can do all of those things. And then there still can be some, some get caught off guard, right? Like some
right.
obstacles you may have to overcome. So at least early testing, we know, leads to early treatment, which gives you more options and, of course, ultimately a better outcome.
That is awesome. And it's so, so important.
Mhm.
Again, um, early detection, right?
Right.
So, a lot of us going into these wellness checks, if it's our first time we're transitioning, maybe from going to those wellness checks with our mom and or dad, or
Right.
whoever in our family members taking us as children, right? And then we transition into adulthood, and it could be kind of daunting, right? Going to these checkups. Um, what are doctors looking for, and why do we need to do these visits? I know that age factors into some of the testings that we have, and we'll talk about that in a little bit. But um, what are you looking for as we're going into these checkups? Why is it important for you to see us on that yearly basis?
Well, we're looking for a lot of things. Ultimately, looking for things that you may have had done, had another doctor. We would love to be the only person you see and that you're just that healthy that you just need a primary care doctor, but that's not the reality we live in. And so we know you often go see other doctors and they may suggest things to you and you may have questions. And so we use this time at the preventative visits really just to kind of answer those questions and make sure if you've had testing, what follow-up do you need? Is there any additional testing that might be warranted or earlier treatment, right? And so there are different medical organizations like the American Lung, American Cancer, American Heart, you name it, every organ in the body has a society or someone who is really working on guidelines, what I like to call like cheat sheets, right? Like telling
Hmm.
us, okay, we know at this age, with these risk factors, with this family history, these health conditions, or diseases, can riddle us, right? And so we really want to make
Right.
sure that we, based on the age, can anticipate those changes and definitely get a running start on keeping you healthy.
That is so important. I mean, it seems to be a lot of different parts to it, right? Because of the
Right.
intricacy of our bodies and how they function and all of that. So
Mhm.
very, very important. And again, we're going to touch on some of these tests and some of these different criterias that you have by different age groups. But just going back to basics, like initially, I'm walking into my doctor's office for the first time. What are some of the things that I can expect from my doctor or from that physician or my nurse practitioner now as well? Those are available, right?
Mhm.
What can I expect during that visit? What are some of the things that y'all are screening for or looking for? And what does that look like for me as a patient?
Right. So, first thing in the door, expect us to be nosy. I'm sorry if you don't know, doctors are nosy people. We want to know the who, what, when, where, how, and why, right? We want to know all the details. We want to
Mhm.
get up in your business because those details are important for us. You may
Right.
think that that one small detail of, a niece that's 16 and just got diagnosed with hearing loss, but we kind of delve further and we find out, okay, maybe her mom or dad had a history and then other family members. And that may either mean you need screening or testing, or perhaps your children if you have kids. And so, really, the focus is going to be on you. So, if you're a shy person, sorry, the preventative visit is going to be, you're going to be on the spot, but that's
Awkward.
okay. Awkward, but be ready for it. But that's just because we don't get enough time in our regular 15-minute visits, right? This is a usually a 30-minute to sometimes if you're lucky, 45-minute visit where we get to really just focus on you and what questions you have going forward. We're going to get your height, right? Height is important for bone health. It can tell us whether or not, you're having maybe some decrease in your bone density, or if you're having hormones that are working out of control and they're causing you to grow outside of puberty, or outside of your teen years. We're checking for weight. No, we're not checking for that 1 or 2 pound increase. Don't even worry
Ah.
about that. We're checking for 5, 10, over time, right? 5 pounds this year, 5 pounds next year, 10 years from now, that could be, 20 to 50 plus pounds, and that could increase your risk for certain other diseases. So, we're
Mm.
going to check it, but, we're not going to beat you over the head about it, right? We're going to check that blood pressure and make sure your heart's healthy, but also your kidneys are functioning properly. We're going to
Mm.
check your eyes, make sure, that your vision's not off and that's what's causing you to make bad food decisions, right? Like we want to make sure that those things are taken care of. Any really good preventative exam is going to include an undressed exam, right? We want to see your skin. We want to check for lumps and bumps. We want to check your lymph nodes, right? We
Mm.
want to check to make sure there's not abnormal bruising or bruising that you didn't know you got. And so all of those things are important. We want to check for different types of moles and potential skin cancers. There are certain melanomas that are, very common in people of color, people with melanated skin. And so we want to make sure that you just don't think it's a random regular mole that your grandma had, but it's actually maybe something, more serious that we need to worry about.
Right.
For your men, we're going to get testicular exams, right? We're going to check for testicular, lumps, bumps, early prevention with checks on that. Self exams also, right? We're going to check for
Right.
hernias, make sure you're not having any problems, disorders, or entrapment that could potentially lead to surgery or, worse issues in the future. For women, we're going to be doing our pelvic exams, our PAPs, and our breast exams. And we can get into, the logistics on that in a
Mhm.
minute. And then also, of course, you're not going to leave without labs. So sorry, you're gonna have to get poked one time. But we're gonna check and make sure, your blood counts are normal. You're not having any anemia, your thyroid is functioning, your cholesterol is not getting too high. Your blood sugars, are you borderline diabetic? We want to make sure we're checking all of those things early. You're going to get some questions about vaccines. Obviously, of course, once again,
Right.
the decisions are always yours. You can, opt in or opt out of any of this, but we're going to have conversations on this is the age in which we see these type of diseases, and this is a way to prevent them with vaccinations, diagnostic tests. So you may hear some of these medical terms, and I'll make sure to break them down. But diagnostic tests essentially is like your mammograms, your colonoscopies, all of those things that you have to go somewhere to get screened are really going to be helpful for you. And then, of course, you touched it on the top of the hour, but homework, you're going to go with homework. Your physical doesn't always land on your birthday. If you're lucky enough to get that, I never am. Then you'll be right on time every year for getting that stuff done. But you may have homework. You may have to leave that visit, wait till your next birthday, the big Holy Grail birthday, and then go get those
Mhm,
tests
mhm.
done. But really, we give you a long landing strip, right? We give you enough time to get that stuff done. And, we're anxiously awaiting those results back so we can have those very important conversations about how we can continue to improve your health over time. So that's just a physical in a nutshell. It sounds like a lot, but I'm telling you, by the time you get there and leave, you're like, that was
Yeah, yeah,
fast.
yeah,
But it's
yeah.
it's a necessary visit, but we also do have a lot of fun in those as well.
Yeah, I think sometimes we feel like we're waiting longer in the time to see you than
I'm guilty
the
of that.
time together.
You get to talking, and then it's just so hard
Yeah,
so hard to let that conversation go. But we do enjoy those
absolutely.
visits, and so that's always helpful. And if you ever have, a doctor-patient relationship, is I like you, you like me. It's a respectful relationship.
Right.
We want you to, trust us, and we want to also trust you. And so trust and transparency is key. We're not asking to be judgmental. We just want to make sure that we are giving you the best advice we can with that good information.
Yeah, and that brings me to the thought of, making sure that we have a physician that fits our needs and understands us is so important, especially when we have, again, a lot of intricacies to our health. Um, so don't stay stuck with somebody, right? If you need to
Absolutely.
change physicians so
We
that,
are not offended, not at
yeah,
all. We
yeah.
want you to feel comfortable. We want you to want to tell us things. We want you to know that if you say something, we're going to be that friend that's like, hey, I don't agree with that, but here's ways we can go about this. We don't ever want you to feel like we're judging you. We're just trying to give you the best advice we can, so that you come back, keep seeing us, and so we can keep living life with you.
That's so, so important. So
Mhm.
yes, we want to make sure that it's the right fit and that we feel comfortable
Mhm.
because it's already, again, daunting. It could be scary. It could be
Right.
a huge
Yeah.
transition. Again, as we were talking about teenage years into adulthood, and my mom and dad or my family member always came in with me. Now maybe I'm transitioning to doing it on my own. And Doc, you and I were talking about that's not always a thing, right? It could be, I know with my daughter, she's 21 now, and I still went with her to the
No.
doctor's visit because I'm a nosy mom and I want to make
Right.
sure that she's receiving the care that I would want her to receive, and for her to transition and understand what the expectations are on her side, and maybe, again, just for support. I know that we have members that have different situations. I want you to talk a little bit about that, and make folks feel comfortable that sometimes into your adulthood, you're still needing support and somebody to be there with you because it's important to have that support, right?
Right. Yeah, a lot goes on in these visits, not only just the preventative visits, but I'll just speak as a whole, every doctor's visit, right? There may be information you don't understand. You may have questions, but don't know how to ask them. And so we're always open. If you come, just say, hey, doc, I just need to give a phone call to a family member so they can take notes for me. It's always important to ask first, of course, but it's always, of course, important to ask. Advocate for yourself and just really making sure that, hey, last time I really don't remember what happened. And so I want to make sure that I'm getting all the questions asked. Me, I'm a nosy daughter. I'm a doctor daughter. So I'm the worst kind of person ever, right? My parents don't go to any doctor's visit without me giving them a list. and then
Right,
double checking
right.
that list and definitely mandating a phone call while they're there. And, us doctors, we love
Mhm.
that. We love to see that your family is in tune with you and your health. We love to see that you have support so that if we have something that we need you to address, that we know that someone else is going to hold your feet to the fire, right? And make sure you don't forget to
Right.
go get that test or put it off just because you don't have the time. And so making sure that you have a healthcare team that sees you, that you feel supported by, and that you feel heard by is the most important part about medicine. It doesn't make us feel good when you don't ask questions, or you leave and we're like, well, did I miss something? It's okay to leave a doctor's
Mhm.
office. We miss you when you go, but we know everyone's not for everyone. But we want you to make sure that you are getting the care and getting the needs met. And so it's
Right.
okay to leave. Don't feel, like you said, don't feel
Yeah.
stuck. There's
Yeah.
somebody out there for you who will take great care of you, but you've got to find that person that fits for you, your lifestyle, and the things that you value.
Yeah, yeah. I remember even language being a factor for
Mhm.
my mom when I was younger, right? And she couldn't speak English at that time. So even having that translation, interpretation, all those things that you need to make sure that your visit is the best possible and you're getting the most out of it. I know that, again, fear is a factor
Mhm.
into the equation. And sometimes we're like, if we don't mention that, maybe, she'll
Right.
miss it. She won't bring it up.
We'll pull it
Um,
out. We'll pull it out.
right, right. So that would definitely be a great way to know about your doctor too, right? That they're
Mhm.
on it
Yeah.
and they're checking those lists, and maybe even if you're not bringing it up, they're still talking about it and helping you to navigate through those uncomforts. Again, different testings bring different uncomforts, right? So
Right. Exactly.
making sure that we have that support is so, so important. So
Hmm.
Doc, we've talked a lot about the what to expect when we walk through the doors and we start seeing you all. I want to get into the different age groups that we have in adulthood, because there's so many transitions that happen from 20s to 30s and 40s and so on. And we really want to just give some examples to folks so that they can know within the age groups what kind of testing and what kind of screenings you all are looking for, or physicians are looking for, or at, or inquisitive about, or nosy about, just because, again, it matters. These different age groups have different things that we want to make sure we have that preventative care on. So we're going to start with their 20s. And I want you to talk to us about, aside from all of these things that you already mentioned, what are some of the things that, some testing or screening that we can look forward to when we walk into the doctor's office in our 20s, for instance?
Right. So 20s for me, I think young, wild, and free, right? Like the world is your oyster. You finally made it. Like you're in your 20s. And so there's still a lot to do, but of course, not as much as you continue to age. So we want you to enjoy your 20s, right? But we also want to be smart about it. So for the guys, we want to make sure we're doing those self exams on the testicles every single month. We want to make sure you get that exam with your doctor's office also. Testicular cancer is the number one cancer for men aged 20 to 34, right? So highly treatable if caught early. And so once
Mhm.
again, as before, being proactive, not reactive. And so really just getting a good handle on that, making sure you're keeping up that routine, because that's going to continue throughout the rest of your life, right? For our ladies, okay, cervical cancer is not the number one cancer in this age group. However, though, it is important, right? So you imagine you just
Mhm.
now gotten into your 20s, so hopefully you've gotten all your childhood vaccination and those things should cover you. But sometimes you miss a visit, you miss a shot, and that sort of thing. But definitely starting at age 21 is when we're going to start our cervical cancer screening, typically about every 3 years. There's not a whole lot of interventions that need to be done because you're so young, so wild, and so free. Your body is working on all cylinders. And so really just efficiently fighting off infections. And so we don't tend to too much worry about, interventions and that. But of course, everyone's different. So I would say this, to back up, shared decision making. You may hear this at your doctor's office. It may be a conversation you have,
Mhm.
but shared decision making is essentially, I, as the doctor, tell you with my medical expertise, these are the things that we should check. These are the
Right.
things that the guidelines and the organization say are important. You, as a patient, should say, these are my values, these are the goals I have for my health, and
Mm,
these are the principles in which I stand by, right? So we want to make sure we honor those. So if you have certain religious beliefs or certain cultural things, we want to make sure we honor those and don't just kind of put our wants and our like hopes for you onto you, right?
right,
Long are
right.
the days gone of medicine where it was really what we call paternalistic, right? Where or patriarchal, where the doctor said this is what we're going to do and you're going to do it, and then you just go run off and do it and you don't know why. No, we want you to have some, not necessarily buy-in, but we want you to have some education and knowledge around what you're getting done. So we're going to have shared decision making where I tell you what I think as a doctor, you tell me what you think as a patient, and we kind of come to a team agreement, so to speak, where we decide, hey, okay, this is the test we're going to do, or maybe not this year, maybe next year. But also that can change depending on your family history and your risk factors.
Right. And that helps with accountability and also us
Absolutely.
taking charge of our health, right? We don't have
Yeah.
to only rely on our doctors and our um physicians to
Hmm.
support us in that way, but then it helps us to be empowered. So I really love that we are a partnership, right? And
Yeah, we are.
we have to have that connection and that comfortability and
Right.
also that accountability so that we
Right.
can
Working in agreement.
work on our
Absolutely.
health together.
Hmm.
That is awesome. Doc, thank you so much. I'm going to go ahead and move on into the 30s. If you're not shy and you want to use the chat and tell us what age group you are in,
Hmm.
without divulging any information that you don't want to share, please go ahead, put 20s, 30s, 40s. I'm not going to say what mine is because, I'm just going to let you guess. But yeah, so 20s, wow. I mean, so much is happening. We're still growing. I know we're still even developing our brains till a
Oh
certain
yeah.
age, right? There's so
Mhm.
much still
Absolutely.
happening with our bodies.
Right.
Hormones and things are still happening. So, and then wow, we get to our 30s, right? It's kind of
Right.
like we've made it.
And honestly, I feel like some people think the 30s are supposed to be so eventful, but they're really not. They're just a continuation of the 20s, guys. Don't worry. Not really much changing here. Of course, in the 20s, I didn't mention, but we're still getting blood work, right? We're still doing the same things that we normally do at these visits. So if you have a family history of something, we're going to be checking that, right? We're going to be checking your cholesterol, your thyroid, your blood counts, your electrolytes. We're going to be checking all of these things in your 20s and in your 30s. Just the timeline for some things in your 30s for women is going to change. So you may go from every 3 years to every 5 years with co-testing, or essentially a pap exam with HPV testing to determine, if there are any potential types of HPV that are high risk for converting to cancer. And so we're going to
Right.
continue that check. But once again, shared decision making. You're still going to be getting your breast exams at every single physical, whether it's with a primary care physician such as myself or with your OBGYN, right? And so
Mhm.
30s is not to be feared, people. We're just keeping up with what we started in your 20s. It's no big deal.
Awesome, awesome. And I mean, we haven't even mentioned women might have had pregnancies already by their
Right.
30s, right? So again, a lot of transitions and as we're going through those transitions, it is important to keep up to date with our checkups and all that stuff just because we want to make sure that we are doing what we're supposed to do.
Yeah, keeping
Well,
keeping track of the things that are the things that need to be done. That's my
yeah.
favorite saying. It's like, it's got to get done. We just got to do it and just roll right through it.
Right, right. We got to definitely make it happen and not
Mhm.
postpone or,
No.
leave it. A lot of times we go years without
Hmm.
seeing our physician because we're
Right.
so busy. It could be anything, any reason. So, being intentional and proactive about it is super important. Well, here we go. We're gonna get to my favorite time, our 40s. When we get here, everybody's like, oh, well, once you hit 40s, that's it. It's
Right.
all downhill from there. Or I know with my readers and my glasses, it's like, oh, how old are you? And I was over 40. And so they're like, yeah, it's just wear and tear.
Right.
So vision issues and other things come up, right? So talk about, what are some of these things that happen during, or once we get to 40, it seems like it's like, use it or lose it. It's the maintenance stage or some of these things, right? So what would you say about the 40s? And again, what kind of things can we expect in our screening?
Right. Well, 40s all is not lost, but it's definitely nowhere compared to the 20s and 30s. So if you haven't done it now, you better start, because 40s definitely is a time when
Mhm.
your body does start to change. Of course, in all of the age groups, we really want to make sure, I want to make sure I not don't forget to focus on, your STD testing. So HIV, gonorrhea, chlamydia, based on your risk, talk with your doctor, right? Share decision making on those tests. But also in your 40s, it just starts to ramp up, right? Let's just be
Right.
honest,
Hmm.
like you said, your near vision starts to dip a bit, that sort of stuff, maybe your energy level, you're no longer able to activate that beast mode in your workout. Things really do just start to make a big change. But specifically for men, I want to mention that, prostate screening or PSA screening, and
Hmm.
your blood work. That's a really important test to start. Now, of course, the baseline is usually around age 45 to 50. If you have a family history, you're going to want to start that around 40 to 45. But once again, talking with your doctor to determine if you want to get that, earlier, or, start at that regular baseline year of about 45 to 50, right? Of course,
Hmm.
colon cancer for both men and women. The screening years ago, I think as late as 2018 used to be age 50. They've dipped it down now to 45. So
Hmm.
age 45 is where you're going to start. If you have a family history or risk factors, you're going to be on 40 to 45. So there's a little
Right.
bit shorter range that you're going to start, but definitely very important. There are various tests that you can get for colon cancer screening. You can do what's called a fecal occult blood test, where the doctor's office will give you some cards. You take them home. We'll drop some special drops on them and be able to determine whether or not it tests positive or turns blue. And that tells us that maybe blood and maybe needing then, of course, a colonoscopy.
Mm-hmm.
Colonoscopy still, of course, is the gold standard for
Ah!
colon screening. So you're going to need a ride. So, call a friend, phone a friend, put it on the schedule, but you're definitely going to want to get that colon cancer screening. And of course, there's other testing that you can do for colon cancer screening as well. But um, that is a very important test to not miss and definitely not postpone. Then also, of course, for your women, of course, we're still keeping up with our PAPs, our pelvic exams, our breast exams, but now here we're adding in our mammograms. And those are
Right.
usually typically every year or every 2 years, depending on, once again, a discussion with your doctor and your risk. But also, that's really important for giving extra information for family history. You may not think, a paternal grandmother, or a paternal aunt is really important to note, but, we may be able to check certain genetic markers to determine if your risk is increased and if anything else needs to be done. So 40s starts to do a lot. Cholesterol checks may become, of course, a bit more frequent, maybe every
Hmm.
1 to 2 years before, maybe every year now. But definitely still all the routine testing, but those things like thyroid and cholesterol sometimes tend to take a mad dash out the door. And so we really want to make sure we're capturing those as well.
Awesome, awesome. And I know we're going to share some tips at the end, but I know here I kind of want to stop and say, share some tips with us. Because again, maintenance stage, I feel like if we can catch it at 40,
I mean, listen,
you
if you
know?
get to 40, all hope is not lost. But if you've not been doing it, you better start doing it, because you're going to wish you'd started before your 50s. That's for sure.
So things like maybe quitting smoking or,
Absolutely. That
or
would be the
eating
perfect time.
well.
Yes. Eating
Um,
well, getting your sleep, I think is one that's often
mhm,
overlooked. Drinking plenty of water, getting
mhm,
some motion and some movement, some exercise, right? Definitely the saying is true. If you don't use it, you'll lose it. So really
right.
making sure you're still trying to tap into that baby beast mode, as I like to call it. I don't have a beast mode active in my workouts anymore. It's just baby beast. I'm just barely making it, but you're showing
Yeah.
up and you're activating those muscles, and you're really giving your body a fighting chance at staying healthy.
Right, right. And like limiting alcohol,
Yes.
physical activity, as you mentioned, protecting our brain is super
Yeah.
important, right? Like we talk about mental health all the time, but really protecting our brain in different ways. And that is the sleep part as well,
Yes.
right?
Right.
Making sure we have ample rest and making sure that our stress is
Hmm.
regulated as much as possible.
Right.
So just some quick tips there. That was great, Doc. Thank you so much. So, We're going to continue, but we do want to mention, and I know Doc mentioned it earlier, any of these ages that we're sharing in some of these different screenings, it does vary. If you have some of these, fa familiar or historical, or it's in your gene, if you will,
Right,
if you have this predisposition
right,
to a particular thing, your doctors will kind of ask those questions at the beginning because we want to make sure that we're not waiting till we're 50 to get a test that maybe we're going to need in our 20s because
right.
we're more prone to it physically, or sorry, I'm trying to say genetically. Thank
Yeah,
you.
exactly. Yeah, I've always
Like,
been a
what's that
sayer.
word?
No, I know it's because they all flow together, right? Like just
Right.
because you have the genes don't mean you have to wear them, but some genes you have to put on, right? And so if you have
Mm-hmm.
a family history of a certain condition, you want to make sure, even if it's, a great something, you never know what that might lead
Mm-hmm.
to, and further questioning and kind of saying, hey, actually I did have a cousin that had that, or my cousin's aunt did have that. And so that may be something that you have to start sooner than your 30s, right? You may have to start in your
Mm-hmm.
20s. And so even with cholesterol, we're doing cholesterol screening in our children under 18, because we
Yeah.
know that if it's a risk factor, it's of course a risk for life, right? And so we really want to
Right.
make sure that you're taking care of those things early. Every single detail matters. Don't ever for one second think that, oh, I don't think that actually is going to be helpful. It may just be helpful, and it may be that one extra tidbit of information that you need to help change your life, right?
Absolutely, absolutely. I know as a mom, again, with my kiddos, I'm always, everybody's different, body types are
Mhm.
different. All of those things factor into, again, staying healthy and what one person needs over another. So
Right.
being mindful of what your specific, recipe to healthy looks
Yeah.
like is important. So we're going to keep going. We're going to touch on the 50s now. So what are some of those things that we can expect, Doc? Or some of those health concerns that maybe you might have in our 50s?
Well, 50s, I'll start with our ladies for the 50s. 50s, oh, the dreaded menopause, right? Late 40s, early 50s, menopause starts. So it's like, oh no, everything feels downhill. So, your energy's up and down, your mood's up and down, you're getting the hot flashes, you're feeling cranky, but then you're feeling great. It's just like the whirlwind roller coaster, right? Like you've done
Mhm.
all these things and you get to 50, you're like, no, not this. But menopause is going to happen. It does happen, but it's important to talk with your doctor, in advance, and just kind of looking out for, like, I'm a bit confused. I'm dragging during the day, or I'm,
Mhm.
stumbling over my words. And that may just be because your hormone levels are
Right.
readjusting, right? They were high here and now they're kind of dipping down low. And so you want to
Mhm.
make sure you have those conversations, and your doctors will definitely help you with how to navigate that if that's the case. Of course, then continuing on with your breast exams, your paps, and all of those things. So those things don't leave the table. We just kind of now start
Right.
adding more things, right? Shingles vaccine, that's an important
Mhm.
one, that can
Mhm.
start at your 50s, right? If you've had chicken pox or not, if you have the chickenpox vaccine or not, shingles still is something that you can have creep up on you. Very
Mhm.
painful, but the vaccine also helps you decrease that risk. Or if you end up having a shingles outbreak, it decreases the severity and the long-term effects of it, right? So that's a definite good one to start. And it's a two-shot series. Make sure you finish the series if you start it, though.
Yeah.
Also, this is an important time. Yeah, that's the key. You got to finish it. And then also certain respiratory diseases like RSV, or respiratory syncytial virus, right? Previously, it was, really only for small babies and children, but now, RSV, comes in all seasons. It used to just be a winter weather season. Now it's in the spring and summer. And so you want to make sure that you're getting that vaccination as well, specifically if you have high risk. So diabetes, heart disease, any of those conditions put you at high risk. And so you want to make sure you have, conversations with your doctor if you have any health condition, to be sure you're getting started early on either any of the diagnostic testing, or definitely specifically like your vaccinations will be very important for you. Of course, then the infamous but so helpful lung cancer screening, right? So you
Yeah.
said before, like, stopping smoking is important. If you can stop in your late 30s, I mean, stopping anytime is helpful, right? But
Right.
stopping as long as 15 years can kind of pretty much give you the same outcome and risk for lung cancer as a non-smoker. And so if we
Right.
keep preaching stop smoking, it's because it does matter. And in your 50s, if you're a 20 pack year smoker, pretty much that means if you smoke 1 pack a day for 20 years or two
Mm.
packs a day for 10, that's a 20 pack year history. And so we're going to want to get you started on your lung cancer screening or your low dose CT. Your low dose CT is pretty much just like an advanced X-ray, if you will, that we take of your lungs that tells us, are there any changes that would make us think that you have cancer, right?
Mm-hmm.
Once
Mm-hmm.
again, early detection, early treatment. And so it's really important to still, even if you're in your 50s, stopping smoking always can happen. You don't think I'm in my 50s, I can't stop now. And like, no, there's still time to stop and still decrease your risk long term.
Right, right. And, we didn't talk about it, but there's e-cigarettes and
Yeah,
vaping
yeah, that
nowadays.
stuff
So
counts.
is that still factoring in the same way as when it comes to what you're looking for to help us to have that preventative care and or support with cessation or anything like that?
Right, exactly. We know there are certain things that you can do to bridge away from, tobacco, cigarette smoking. All those things are helpful to get you out of the smoking pathway. But
Mm-hmm.
even then, still those things are, increase your risk for certain lung conditions, infections, increase your risk of getting sick and that sort of thing, upper respiratory infections. And so we just really want to be sure that, if it's a bad habit and someone says it is, then chances are we're not going to want you to be doing it, right? And so
Right,
anything you can
right.
do to kind of help maximize your health is going to be the best long term, right?
Absolutely, absolutely. That is amazing. So we're going to go ahead and keep going into our 60s. And Doc, what can
60s.
we expect during this time?
60s, this is my favorite age group. Forever young, right? You
Speak
live
for
wild,
yourself.
careless, and free. I know, wild and free. You've done all the things that are the things in your 30s and 40s and 50s, and now at 60s, just like, okay, now I feel like to get a break.
Mhm.
But there are still some things we add to the list in your 60s, right? So you're still going to keep up with your routine monitoring for both men and women, still checking for testicular cancer risk. We're still checking for breast cancer risk. We're still doing all those things. But now we're going to add on one fun one. We're going to add on a bone density. And this is
Mm.
specific for women, right? Over 65. Now, if you have a family history, if you've been on medications, or you and your doctor talk about, there may be other risk factors that you have, you may start earlier. You may start that in your 50s, right? But typically in your 60s and when most women start bone density screenings. And bone density is important for if you've ever heard she stepped off the curb and broke her hip, bone density is
Oh, yeah.
important. So really want to make sure you're talking with your doctor each and every year, both men and women,
Hmm.
about the fragility of your bones and if you are getting enough calcium and if you're getting enough vitamin D in your diet. You may have to ask for a vitamin D test. It may not be a routine screening that your doctor, routinely orders. You may have a family history, or if you have, melanated skin, you may not necessarily be out in the sun enough to get that conversion to the active form of vitamin D. And so you may need to take a supplement if you don't drink milk, right? Or drink a lot of, or have a lot of dairy products. And so those are those kind of side conversations that you want to have because we want you to still be exercising because impact on the
Hmm.
bone leads to more bone growth and keeps your bones healthy. But sometimes, that kind of exercise may not be able to do that exercise, right? Maybe you have sore joints, from your 50s, from a long history of, playing sports. And so that activity
Right.
may not help you build bone, but you may need to add supplements with, of course, in consultation with your doctor and making sure that, you're optimizing your bone health. Because of menopause, menopause can throw us into, a decrease in bone density. And of course, for women, heart health, right? So estrogen
Right.
is so protective. I think of the body as like Goldilocks, like it can't have too much, you can't have too little. You have to have like just right, just the right amount, right? And so if
Right.
your
Right.
estrogen's really high, you're getting good heart protection, you're getting good bone protection, your body's not allowing bone to break down. But of course, in menopause, all those hormones are stripped. And so now you're at increased risk for bone fragility and fractures, and also, of course, heart problems and heart disease in women. So you really want to make sure you're doing the best you can with what you have to stay on top of it. Of course, in your 60s, falls are a huge thing. So making sure you're keeping a track of those. And, a stumble is not a fall, but it's still something your doctor wants to know about, right? And so
Mhm.
making sure, you advocate for yourself. Hey, I actually had a stumble the other day. I'm not quite sure. There are different really quick tests that don't require anything other than you to get up out of a chair, walk across the room, and come back. for us to be able to tell if you're going to be at an increased fall risk and if we need to seek additional assistance in keeping you healthy at home. Of course,
Right.
all of your vaccinations, flu, COVID, like I said before, RSV. If you have at this point, you may have grandkids, in your 30s, you may have them in your 40s, but even then, certain vaccinations like your tetanus booster for tetanus as well as pertussis, right, a respiratory disease that young children could get, but also so can adults and pass that on. And so you just really want to make sure you're kind of keeping track of those things.
Right, right. And I know for men, after 40s, testosterone is
Mhm.
something that you're probably keeping track of, right? Because it
Right.
lowers. What are some things with men that are specific to them that maybe you want to mention in
Well,
any 40s,
definitely, yeah.
50s, or 60s?
Yeah. No, so yeah. So for women, menopause, right? But for men, yes, you're correct. Testosterone can kind of take a dip down as well. And so that may present as same thing, fatigue, decreased energy, you're not getting those good lifts that you were before in the gym. You may notice that, you may feel like you're picking up a bit of weight. Testosterone is helpful in building lean muscle. And so,
Mhm.
those are typically the tests that we don't routinely test for. But if you're like, hey, you know what, I'm having some issues that I'm not really quite used to. Do you think it could be this? And those tests can definitely be added on to your preventative visit.
That is amazing. Thank you so much, Doc. I know that just in every area, right? Sometimes when we think about the 50s or 60s, 40, 50, 60s, we start to think like, you know, uh, what I do to support my health is not going to be as effective, right? And sometimes we can get discouraged or not go to the gym as much. But I do know a lot of folks that are in those age groups and they look fabulous. They're doing great and they're maintaining their health. And, they're the ones out running around with their grandchildren, right? I know I want to be that kind of grandma when a long, long time from now when that time comes.
Love.
But so important to we just want to encourage everyone to continue to um be motivated
Right.
to seek that whole health for yourselves. We haven't talked about surgeries and how that factors in, and
Right.
anything else that comes with life,
I
and
know.
just things that happen out of our
Hmm.
control, right? And the importance of also making your doctors aware of that. I know that you refer to specialists, again, going back to your
Hmm.
original information at the beginning, where
Hmm.
um, there are specialists for different parts of the body, depending
Right.
on what your needs are. So, always communicating with your doctors, whether you think it's a small thing or a large thing, share it all because that's going to help them to better support you in your health journey.
Absolutely.
So, we've covered so much, Doc. I want to stop here because I know we've got some tips, but I want to open it up for to see if there's anything in our Q&A. Guys, use your chat. Give me a reaction. Hopefully, you've had fun with us and learning all of this important information that we've shared with you and that Doc's shared. So Beth is with us. Beth, did you have any questions come up while you were checking out our Q&A?
No, there's no questions right now, so please feel free if you have some to pop them into the Q&A and we will get those moderated.
Okay, so you
Kelsey, do
know
you want
what?
me to go ahead and
Hmm.
pull up the tips? Perfect.
Yep. Awesome. Thank you, Beth. So yeah, Doc and I definitely don't want you to go. We've shared so much. Again, this is going to be available for you to view again. In our website, this video, we covered so much, but we definitely wanted to leave you with some tips for you to stay healthy and make sure that you receive the support that you need. So, one thing that I know is helpful for me and a lot of people do is mark your calendars, right, Doc? Like you were talking about, hey, if you can get that checkup done yearly on your birthday, that would
Right.
be amazing.
Real
But
easy.
marking your calendars and making sure that you're intentional about it. I know we're again, as a mom, I'm really good about it with my kiddos, but sometimes it's like mom is at the bottom of the totem pole for needs. So, put yourself first, and take care of yourself and mark your calendars, so that way you can stay healthy. If you want, you can keep a folder, right? There's so much information that we take and that our doctors give to us. So, making sure we keep a folder, to keep ourselves informed and to also, have those health tips or that progress and that screening, those things that we're going to work on. It just helps for us to stay in tune, but also organized around all this information that sometimes we're receiving. It's like a lot, right?
It's overload for
Um,
sure.
Knowing what kind of screenings you might need. Again, your doctor is going to share that with you. These are just tips that we're giving you, but always, always check in with your doctor, your physician, your health practitioner, whoever you go to, and make sure that these things work for you. Make a list of some of those questions. And you and I were talking, Doc. I don't know what questions to ask half of the time.
Right.
I'm just like, I gotta check this box. What are some questions that I could come up with or that you think it's important to us for us to have in like the back of our mind to ask our doctors so that way we're more proactive about our wellness.
First off, we welcome questions. I can tell you, I wrote the questions here. This was my favorite way to see questions, which was
Mhm.
essentially on an envelope, like bring your questions on a sticky pad, on your phone, however, but just bring questions. It helps us know that you're actively involved and that you're wanting more information.
Mhm.
But of
Mhm.
course, if you don't have questions, that's okay. Something we say may spark questions for you in the future, and just feel free to reach back out to your doctor and ask those questions later, right? But I would say
Mhm.
a good question, if you don't have one to start with, is what are the biggest health risks I should focus on? And so
Mhm.
for you, it may be, what menopause looks like, right? Are there the medications that you may need to start? Are there other risk factors that you're having, with activities that you're doing, like things that are important that are a risk? Like, what should you focus on? I'm in my 30s, doc. What should I be focusing on, right?
Mhm. Mhm.
All right.
Mhm.
Then a second question, if you don't have any, is what symptoms should I not ignore over the next year? This is a really good question because we can also think that, feeling sleepy and tired, oh, I'm not getting enough rest, or, feeling sluggish. I'm just not eating the right amount of foods, but that actually could mean your thyroid's out of whack or that maybe your blood sugars are starting to
Mhm.
creep up.
Mhm.
And so those are really good questions that, it's easy to ignore things. My belly's a bit swollen and it's not really been, well, that may be something more serious for us to investigate. And so and knowing what not to ignore helps you be more proactive in getting in to see us sooner. And I'd say the last final question, maybe something, are there trends in my health over the last few visits that you're concerned about or that I should be concerned about? And this could be simply that each year your cholesterol level's gone up 4 or 5 points, and
Mhm.
now we're,
Mhm.
significantly higher than the top of the range, right? And so
Right.
those things are really helpful because you may not go to your doctor often. If that's your case and you're healthy and you only go once a year, that's great. But that's not always the case. But sometimes you see this doctor, you see the heart doctor, you see the lung doctor, you go to the urgent care, and we're getting so many snapshots throughout your life that we're not able to connect the dots. And so that's a really good time when you're like, hey, I got that blood work back. That looks like that's higher than that. And so that's a good
Mhm.
way for you to kind of keep track of the trends and changes happening in your life.
I love that, especially because sometimes we have certain testings that start at a particular age and we continue throughout different age groups. And what you're looking for is those changes.
Right.
Are there any changes? Is there a progression? Did,
Yeah.
did that number go up or down or whatever it
Mhm.
is to, again, to know if there needs to be, excuse me, any interventions necessary. Reviewing our medications, super important, right? Because that's going to factor into our whole health as well. Also, stay up to date with those vaccines. Again, conversations to be had with your physician. Don't skip those checkups, as we said before, even if you feel like you're fine, you're on top of the world, and you're doing great on your own. I know that even some of my doctor friends are not really good about getting their own checkups, right? So it's like sometimes
There
within the fields that we might have, we might feel like,
can
I'm
check
good, I'm
myself.
good.
No, I am definitely, there are a lot of things I'll do by myself, but that's the one thing every year without fail, I'm at my doctor's office. He knows that I'm coming in December before the end of the year. So that way, hopefully I'll have at least the 11 months to get myself together
Right.
and give him the rundown, and we get it checked. And I feel like every year in January, I'm starting with a clean slate. I'm starting with more information, and I have homework to do, right? I've got tests
Right.
and things to get done, and I feel motivated to do it every time.
Awesome. Awesome. Again, any lifestyle changes, any doubt, any concerns, speak with your physician and your doctor, your wellness specialist, whoever you go to. Partners is here to support you, and we're going to share some contact information in a bit here with you. So again, you have so many supports available. Beth, I don't know if you had any questions during the time that we were sharing our tips, so I'm going to go back to you to see if there's anything that we need to answer with our Q&As.
Yes, we did have somebody put in, what about your 70s?
Oh, good question. And yeah, we weren't trying to be biased stopping at 65 or plus. We said 65 plus, but yes, good one. What about your 70s, Doc?
70s, I feel like is the sweet spot. Like you've done everything, you've kept up with your health. At this point, 70s to me sometimes just feels like smooth sailing. A lot of the interventions that we were doing before, perhaps like colonoscopies, maybe your mammograms, definitely your pap exams for women, those things start to phase out because now you're not at that high risk anymore. So 70s really is that good special sweet spot where, you've done all the things, you've taken great care of yourself, you've kept up with all your visits. And in your 70s, still we're doing routine screening, your cholesterol, obviously, of course, we're still doing checks for your blood sugar, your thyroid, those sort of things. But the interventions and things start to kind of back away because you've done such a great job. When your risk was high, keeping up at your 70s,
Right.
we feel comfortable with removing some of those recommendations.
That's amazing. And I know folks that are in their 70s and they are looking good. They're doing their
Fantastic.
stuff. They are dating. They are.
They've got it figured out. I'm like, hey, wait, can they teach a class? Because like we want to do that. Like I want to be that active runner in my 70s, around the neighborhood.
Right.
I want to, not be worried about bone density because I've done the work in my 30s and 40s and 50s, right? And so yeah, it's we remove some things. It doesn't mean that your doctor might not suggest you continue, right? Your family history may say, you know what, hey, you have to continue these certain screenings. But once again, that shared decision making, that team effort where you can decide with your doctor, you know what, I think the risk is so low right now for me with this that I feel comfortable not having this checked as often.
Yeah, and it doesn't stop, life doesn't stop in your 70s or even
No,
80s. I
it's just
feel like,
getting good.
again, I have so much um examples that come up to mind of folks that even again they've lost a bunch of weight, they've
Right.
gotten fit, their whole life has changed at 70,
It's never
and
too
they put
late.
in their work, so it's never too late. That's
Never
right.
too late.
All right, what else do you have for us, Beth?
So there was another statement, and it said test based on family history. So I'm going to assume that means what are some of the tests that could be performed for family history type health conditions?
There's a lot. So
Yeah.
prostate, for instance, prostate screening, that can be a test for also family history starting earlier. Of course, your mammograms, we're starting in our 40s, but if you have a family history, you may start in your mid to early 30s, right? Of course, that also includes your bone densities, like we discussed earlier. If you have a family history of bone density loss or low bone density, that may be something you want to start earlier as well. Of course, your thyroid, your cholesterol, all those things are still important tests, but also those can be started earlier too, right? And also more frequently. So the frequency of it may be 1 to 2 years, 2 to 3, but because of your family history, you may have to do it more often.
Right.
And so once again, that is a definite great question and a good conversation to have with your doctor on, hey, you've seen my family history, you know the risks I have, this is what my current lifestyle is. What tests should I be doing sooner, if any?
And you have folks that are adopted,
Right. You don't
and
know your
don't
family
have that
history.
family
Right.
history. So digging deep.
Check everything. Really check everything. No, but
Yeah.
definitely to have a discussion with your doctor. Those things are so important.
Yeah.
And don't want to forget those folks. And maybe you're not adopted and maybe your family just is, like some families very private about health issues and not telling you. And so in that case, then we may have to maybe add one or two additional tests just to make sure we get a good baseline for you, right? Sometimes you don't have that history, which is okay, but we can always start with the baseline and then we can build upon that and determine if your changes are normal or if your changes are abnormal.
Awesome, awesome. Doc, thank you so much. This has been amazing. We've shared so much information. I hope that our participants have taken notes. And again, this will be available for you in our website. We're going to pivot. Again, thank you so much, Doc, for being with us. We'll stay on for a little bit. I'm just going to share some partners' information and some information that we want you to be aware of so that you can stay connected. We want to be part of your health journey. We want you to be the healthiest you possible. We're here to support you. With that conversation in mind, we do have a population health member survey that has now that is now live. And so we do have a link for that Kimberly's putting in our chat. We do have a survey that we want you to fill out. We want to support you. And the way we do that is hearing from you, not only what kind of things we want to share with you through Membering Cafe, but also just in general as we're supporting you in our communities and as you're calling us and getting in contact with us. We also have the survey related to Member Cafe. We want to know what kind of things you want us to talk about to support you in your health journey. So please fill out these surveys. It takes a moment to do that. We want to hear from you. I'm going to quickly just share some information. I know we're over 2 o'clock, so thank you so much. I think it's just been so helpful to hear everything that Doc had to share with us. It really does motivate us to keep in track with our wellness checks and just the support that we need to be healthier. So if you want to contact us, we have our member and recipient service line that is available 7 a.m. to 6 p.m. That's 888-235-4673. We have our behavioral health crisis line, which is 833-353-2093. That's available 24/7. And again, you don't have to be in crisis to call us. We're here for you. We also have folks that speak in other language. So if you're calling and you speak a different language or you need translation or interpretation, please let us know. We're here to support you. We have a non-emergency medical transportation number that's available at 833-577-2309. Our nurse advice line. Hey, if you have any questions, our nurses are available. Doc, you work a lot with our nurses, I'm sure. So that number for them is 888-369-2452. I almost forgot numbers there. Again, that's available 24/7. So please give us a call. We also have pharmacy services available at 866-453-7196. 24/7 available. We know medication, it plays a huge factor with all of this and maintaining our medication and making sure we have what we need available is important. We also have telehealth or teledoc services, right? So again, any concerns, anything comes up, please feel free to reach out. That's available all the time, as well as a link that's available in our website. So the number for that is to register to teledoc or telehealth is 800-835-2362. So you have to register first. We get you in there and then you can use the service. So it takes a little bit of a moment, but get it done. It's a great service that we have available. And again, we have provider services. So if you need help with finding a provider or you are a provider and need support, it's 877-398-4145. And for us, our member engagement team is always available to support you with any questions. Our email is memberquestions@partnersbhm.org. Thank you all for joining us today. Please stay connected. We love having you and sharing with you, Doc. Thank you so much. Beth, Kimberly, thank you for supporting us. This was a great great time together. I feel empowered, so I hope our participants do too. We'll see you next time. Next month, we're going to talk about some of the chronic illnesses. We're going to touch on diabetes in March as we continue to talk about staying healthy and healthy you. So we'll see you then. And please register online if you haven't already. Tell your friends. And we'll see you again in March for Member Cafe. Take care, everyone.